disease does not begin in the hospital. It does not begin in the operating room. And it does not begin on the day someone experiences chest pain. It begins quietly, slowly, and often invisibly in the kitchen, on the plate, and in the daily habits that shape the health of our arteries over decades. And the shocking truth about heart disease prevention is that most of it is within our control long before medication or surgery ever become necessary. Every time food is prepared, ingredients are selected, oil is heated, salt is added, sugar is stirred in, or packaged snacks are opened, a choice is made that either protects the heart or slowly strains it. Because the heart is not only a pump but a muscle deeply influenced by inflammation, cholesterol levels, blood pressure, blood sugar balance, body weight, and metabolic health, all of which are powerfully shaped by diet. Consider how arteries become blocked. It is not an overnight event but a gradual process where excess LDL, cholesterol particles, especially when oxidized by inflammation and poor lifestyle habits, begin to deposit along artery walls, forming plaques that narrow blood vessels and restrict blood flow. And what drives this process is often a combination of processed foods, trans fats, excess saturated fats, refined carbohydrates, high sodium intake, and chronic overeating. Prevention, therefore, starts with understanding ingredients. Cooking oils matter greatly, as repeatedly heated refined oils can produce harmful compounds, whereas using stable oils in moderate quantities and avoiding deep frying reduces oxidative stress. Portion control matters because even healthy foods in excessive amounts can lead to weight gain, insulin resistance, and increased cardiac strain. Salt plays a critical role because excessive sodium intake raises blood pressure, forcing the heart to pump harder against resistant arteries, gradually thickening the heart muscle and increasing the risk of stroke, heart failure, and kidney strain. Yet many people underestimate hidden salt in packaged foods, sauces, pickles, breads, ready-to-eat meals, and restaurant dishes. Sugar is equally deceptive because excess refined sugar spikes insulin levels, promotes fat storage especially around the abdomen, increases triglycerides, lowers protective HDL cholesterol, and accelerates inflammation, all silent contributors to heart disease. Fiber, on the other hand, is one of the most protective components of a heart. Healthy kitchen, as whole grains, vegetables, legumes, fruits, nuts, and seeds help reduce cholesterol absorption, stabilize blood sugar, improve gut microbiome health, and reduce inflammatory burden. Protein choices also determine heart outcomes. Lean plant proteins, legumes, fish rich in omega-3 fatty acids, and moderate portions of healthy dairy or lean meat support repair and satiety without excessive saturated fat load, whereas heavily processed meats high in sodium and preservatives contribute to vascular stiffness and inflammation. Meal timing and mindful eating are often overlooked, but consistent meal patterns, avoiding late-night heavy meals, and eating slowly improve digestion, metabolic balance, and weight control. Hydration is fundamental because adequate water supports circulation, kidney function, and blood pressure regulation. Cooking methods make a difference. Steaming, baking, grilling, sauteing lightly rather than deep frying preserve nutrients and reduce harmful compounds. Grocery shopping habits reflect prevention strategy. Reading labels, avoiding products with long ingredient lists filled with artificial additives, hydrogenated oils, excessive sodium, and added sugars transforms the kitchen into a place of healing rather than harm. Prevention also involves understanding that heart health is cumulative. Small daily choices compound over years, meaning that replacing sugary beverages with water, choosing fruit over dessert, reducing portion sizes, limiting ultra-processed foods, And increasing colorful vegetables may seem minor in isolation, but together significantly lower cardiovascular risk. Importantly, prevention is not about extreme dieting or eliminating entire food groups without balance, but about sustainable habits. Balanced plates with vegetables occupying half the portion, adequate lean protein, whole grains instead of refined flour, minimal added sugar, controlled salt, and mindful fats create an internal environment where arteries remain flexible, cholesterol remains controlled, and inflammation remains low. Kitchen organization itself influences behavior, keeping healthy snacks visible and accessible while limiting storage of processed junk food reduces impulsive unhealthy choices. Family involvement matters because shared healthy meals cultivate collective heart protection. Especially teaching children early about nutrition builds generational prevention. For individuals who already have high blood pressure, diabetes, obesity, or a family history of heart disease, the kitchen becomes even more critical, as diet can significantly improve blood markers, reduce medication dependence in some cases under supervision, and slow progression of arterial damage. Even after cardiac procedures, long-term outcomes depend heavily on dietary discipline because surgery corrects blockages but does not cure the underlying lifestyle factors that created them. The shocking truth, therefore, is not that heart disease is unpredictable, but that many of its strongest risk factors are modifiable within daily cooking and eating habits. Consistency outweighs perfection. Occasional indulgence does not cause disease, but chronic imbalance does. Stress eating, emotional overeating, and sedentary habits amplify dietary harm. So pairing nutritional discipline with regular physical activity, stress management, and adequate sleep multiplies benefits. Prevention also requires awareness of body signals. Unexplained fatigue, weight gain, rising blood pressure readings, increasing waist circumference, and abnormal lab values are early warnings that kitchen habits may need correction. The empowering message is that prevention does not demand expensive supplements, complex programs, or extreme deprivation, but rather informed, conscious, repetitive, healthy decisions in meal planning, food preparation, and portion awareness. Every chopped vegetable, every balanced meal, every reduced teaspoon of salt, every avoided sugary drink becomes an investment in arterial health, cardiac efficiency, and longevity. Over months and years, these habits reduce the likelihood of heart attacks, strokes, bypass surgeries, and stent procedures, preserving quality of life and independence. Ultimately, heart disease prevention is not a single action but a daily practice, and that practice begins not in the clinic, not in a pharmacy, but in the kitchen, where prevention is cooked, plated, and served one meal at a time, transforming ordinary routines into powerful protection for the most vital muscle in the body,